All right, Assalamu alaikum, everyone. Welcome to IMANA's webinar. We're going to be talking about, our topic is about the heart 101. We have with us here Dr. Basir. Dr. Basir is, I'm going to tell you a little bit about Dr. Basir. He's a cardiologist. He specializes in the treatment of complex heart blockage with minimally invasive techniques using balloons and stents. He is one of the handful of people in the country who has completed dedicated training specializing in techniques to open chronic total occlusions or heart blockages that have been completely blocked for many months or years. He is the national leader in the treatment of cardiogenic shock and lectures around the world on the use of temporary heart pumps when the heart is failing. All right, without further ado, Dr. Babar Basir.
Thank you so much, Rehan. Assalamu alaikum to the audience. It's a pleasure to be here today with IMANA. It's an organization that I really love and support. I think they do a tremendous amount of work, and I'm always looking forward to being involved with this group. Today, we're in the month of February, which is Heart Awareness Month. So the IMANA organizers reached out to kind of give a little bit of information on heart disease. And my particular specialty is coronary artery disease and heart blockage. And so I'll share a little bit of that with you here today. So the objectives of the talk are to describe the burden of heart disease in Americans today, describe what causes a heart attack, how to prevent a heart attack, how to treat a heart attack, and then focus a little bit on the disparities that we see in heart disease and potential ways that we go about in overcoming those diseases as well. So the burden of heart disease is really quite significant in the United States. So every 25 seconds, somebody has a coronary event, either a heart attack or a stroke. Every 39 seconds, someone dies from a heart disease or stroke. Approximately, over 800,000 patients will have their first heart attack in any given calendar year. And about 500,000 people will have another heart attack. So this is really quite staggering. Clearly, heart disease is the #1 leading cause of death in the United States. But what's really kind of remarkable is the fact of patients' perception on heart disease itself. So despite 1 in every 3 deaths occurring because of heart disease, you can see that only 44% of patients actually monitor their blood pressure outside of their doctor's office. 60% don't know their blood pressure or their cholesterol numbers. 56% of adults are told by a healthcare professional to improve their health. 83% believe that heart attacks and strokes can be prevented, but they aren't motivated to do anything. And that's really something that we really want to help with in a webinar like this, is to really motivate people that have heart disease, that are at risk of heart disease, that have family history of heart disease, to be motivated to prevent coronary artery disease from occurring. So I think that this is really, clearly a global problem, not just across the Western world or the United States in particular. And I really wanted to kind of emphasize a little bit about how this affects us as a Muslim community. So one example is a study that's sponsored by the National Institute of Health, known as the Masala study, interestingly enough. So this is a study that looked at hundreds of patients from South Asian descent, so India, Pakistan, Bangladesh, and who immigrated to the United States. And so, that's us that are living here today. And what's really interesting is to, kind of share with you some of the insights from that study. So South Asian men and women are more likely to die from heart disease when we compare ourselves to Caucasian Americans. We actually develop the risks for having coronary artery disease at a younger age. So we develop high blood pressure, high cholesterol, diabetes, an average of a decade before other racial and ethnic groups. And that means that we're facing coronary artery disease at a much higher and staggering level. Similarly, South Asians develop high blood pressure, cholesterol, and diabetes even when we're at a normal weight. And so this is something that we really have to be worried about, even in those of us who are, have a normal weight. So it's important for us to talk to our doctors. It's important for us to understand the importance of a healthy lifestyle and eating lots of fruits and vegetables, not smoking, exercising regularly. It's very interesting that South Asians are actually born with less muscle and more fat than other races. And so this may predispose us to developing diabetes and other health-related complications. And I think one thing that's really undervalued and understated is the importance of mental health. So chronic stress, worrying about incomes, worrying about jobs, or being highly motivated in work where it kind of takes over your life. These are really well-known triggers that may lead to premature coronary artery disease and maybe some of the most important risk factors for developing a myocardial infarction or a heart attack. And that's what I'm going to spend a little bit more time talking about here today. So what causes a heart attack? So at its simplest level, blood vessels have 3 layers that are associated with them. And for one reason or another, this can be due to genetic predisposition, risk factors from our, from other diseases that we have, or environmental risk factors related to diet, exercise, things that we'll talk about later today. They predispose the blood vessel to developing increasing plaque. So these fatty deposits or plaque, accumulate within the blood vessels themselves. And what ends up happening is that they narrow the blood vessels. And the blood vessels are really accommodating. They can get bigger to be able to kind of accommodate that plaque. But over time, it continues to narrow, and it can narrow enough to decrease the blood flow to that area of the body. So this is what can lead to stroke, for example, in the blood vessels in the brain, and it can lead to a heart attack when we're talking about blood vessels in the heart. Now, you can also get an acute event as well, where it's not just that plaque continues to grow, but for whatever reason, it could be related to stress or smoking, but a vascular injury can occur where the plaque actually ruptures. And so the fatty deposits that are in the plaque are exposed to the blood, and the blood recognizes this and tries to create a clot over that plaque. And in doing so, that plaque could actually that blood clot could block the flow of blood to that organ. Again, the brain, it would cause a stroke, and in the heart, it would cause a heart attack. And that acute event can lead to, very significant problems. It can be life-threatening, and it's something that needs really rapid and early treatment. So how can we prevent heart attacks and strokes and vascular complications from occurring? So one of the most important predisposing risk factors that we have to prevent heart attack and strokes from occurring is to control our cholesterol. And that's because the cholesterol, high cholesterol, is associated with buildup of this plaque within the blood vessels. And so using diet and exercise, as well as medication, the most common of which is called statin therapies, is important to help reduce that risk. And when we talk about, really pure, scientifically proven ways of preventing heart disease from occurring, the use of statin therapy or cholesterol lowering medications is one of the most well-studied mechanisms of doing that. Now, it should be done with a doctor recommendation, having checked your cholesterol levels, and assessing the risks and benefit of any given therapy. But really, it's probably the most pronounced and effective way, and one of the ways that comes with the least amount of risk involved as well. It's also critically important to control other things other than your cholesterol. So high blood pressure or hypertension is a major risk factor for developing coronary artery disease. So high blood pressure is when the blood pressure that's in the heart or that's in the blood vessels actually causes trauma to the inside of the blood vessels. And that trauma can lead to plaque buildup, and it can also lead to the development of heart attack. And so in treating blood pressure, whether it's with diet and exercise, and if that's not effective, with medications, is one of the most effective ways for us to decrease our risk of heart attack and stroke. And it's really important to talk about diabetes as well. So diabetes is one of the most important diseases as it relates to the coronary artery in general, because diabetes affects so much of the different processes that are involved with a heart attack. So the high blood sugars can actually cause trauma in the blood vessels themselves, and that can lead to an increased risk of plaque buildup and rupture. Also, diabetes can lead to decreased ability of the blood vessels to actually form a clot well. So that can be problematic in patients as well. And so, these are all things that kind of lead to worsening outcomes. And particularly with diabetes, patients tend to get really diffuse blockage or blockage in multiple areas of the heart, sometimes best treated with even open heart surgery. So it's really something to be cognizant of. One, the identification of diabetes in the first place. And number two, if you are a diabetic, to really have a very tight control of your sugar. So those are diseases that we need to control: hyperlipidemia, hypertension, and diabetes. There's also environmental things that we can do to help decrease our risk of a heart attack as well. So smokers are 6 times more likely to suffer heart attacks than non-smokers. And that's because of the carcinogens that are there that can actually, again, disrupt the integrity of the blood vessels. And so it can lead to plaque and plaque rupture. So it's one of the most important things that we can do. And if you quit smoking, you can actually reduce your risk of having a heart attack after quitting for 1 year by over 30%. That's better than any medicine. So if you could do one thing to prevent heart attack and stroke and you were a smoker, that the biggest benefit you would have would be to actually quit smoking. It's also important to have a really good control of your diet and exercise. And so the aim in terms of exercise is to be able to do 2.5 hours or about a half an hour per day of aerobic activity. And, a lot of us, our uncles and aunties would like to go for, a 30-minute walk at Maghrib time. But let me argue here that that's not really an aerobic activity. And we need to increase the pace of that walking, try to actually break a sweat while we're walking, though walking is still better, even leisurely, than sitting at home. And then, something that's really critically important is to have a very good control of our diet. And that's just something particularly within the Muslim community has been really, really difficult for us to do. We really, have eaten very poorly, a diet that's high in carbohydrates and fats, and we really need to be able to change that to be able to improve our long-term health. Let's say, you've already, developed heart blockage. So currently, how do we treat heart blockage? So the most important therapy for heart blockage is actually medicines. It's a combination of a different groups of medications. These have all been tested in the most scientific ways possible. As I mentioned, the most important medication that we can use is statin therapy or cholesterol lowering therapy. These medications prevent heart attack and stroke from occurring. They can also reduce the plaque burden and the progression of plaque within the arteries of the heart and brain. And those are really the cornerstone of therapy. For people who have an adverse event to these medications, there are new medications called PCSK9 inhibitors. These are shots that you can actually take, for example, every other week to be able to help lower the cholesterol levels dramatically. And because our population has a very high prevalence of uncontrolled cholesterol, many people within our community are on those injections and medicines as well. The second most important medication that we can use is a baby aspirin. Aspirin can actually help bind onto the blood platelets and keep the area from causing a big clot. This is really, really important in preventing heart attack and stroke. Now, unlike the cholesterol medication, which is pretty rare to have a side effect, or a significant side effect, I should say, aspirin does come with a slightly increased risk of bleeding. And so a few years ago, a decade or more ago, we would actually prescribe aspirin pretty routinely as a preventative tool. We know now that because of this bleeding risk, there are certain populations, particularly elderly women, who may be predisposed to the bleeding risk more than they would be getting any benefit from lowering the risk of a heart attack or stroke. And so it's something that should be individualized and something that needs to be talked to with a doctor. There are also medications that reduce the workload on the heart. These medications also help improve the symptoms of chest pressure and pain that a person can feel when they have heart blockage. And those medications, along with other medications like the high blood pressure medicines and controlling your diabetes, they're really the cornerstone of treating long-term heart blockage. That being said, sometimes more than medications are needed. And there's two ways of really opening up the heart blockage that's there. The most common way is with balloons and stents. And so in that situation, you're not really removing the plaque, but you're pushing the plaque to the side of the blood vessels and using a drug-coated stent, which basically pushes the plaque and keeps the plaque off to the side, and it restores blood flow down the heart. This is particularly done in a heart attack situation. There's also open heart surgery, where they take blood vessels from your legs or through the upper arm and other places in your body, and they actually, rather than going through the blockage, they actually just go around the blockage and they bypass the blood vessel. And in patients who have multiple blockages in hard to treat areas, that's the standard of care. Clearly, it's a much bigger operation with a much longer recovery. You typically spend about a week in the hospital and then about a month in recovery after a heart surgery. There are newer robotic options for heart surgery as well that are limiting some of those risks. And the alternative here with balloons and stents is usually an overnight stay, sometimes even a same day procedure where you get to go home at night. So really vastly different profiles, and doctors should be consulted for both scenarios when heart blockage needs to be treated, so that we can individualize care to patients. So I thought it was really important as a community to have an understanding of what would typically happen if you or a family member had a heart attack. So the signs and symptoms of a heart attack are pressure-like pain within the chest. Sometimes you can feel shortness of breath. Sometimes the pressure can go over to your left shoulder, jaw, into your back. It feels like a heaviness on your chest. And that's a typical way of describing things. Sometimes you have more atypical symptoms. Sometimes you may notice just shortness of breath. Elderly patients may not experience those symptoms as much, or even in diabetics, and they may just feel nauseated. They may break out into a sweat and not know why. They may feel a heartburn that's kind of persistent. What's really, really important not to minimize those symptoms, particularly in patients who have risk factors or a family history of having heart disease. And so even though we're in the middle of a pandemic, our hospitals are open. If patients are experiencing chest pressure, shortness of breath, they really do need to come into the hospital. The hospital is getting to be a safer and safer place. We've been doing heart attacks throughout the pandemic, but it's really, really important because we know that there's data that patients aren't coming in. And it's really, really important to make sure that message is out. So if your loved one is experiencing those symptoms, the first thing that you would do is call 911. You would ideally go via ambulance to your local hospital. It's really important. I know, as a community, we sometimes want to not use these services. We want to have our loved one, our children take us to the hospital. But we should know that there's always a risk of having a cardiac arrest on your way. I'm taking care of an unfortunate patient in the hospital within this past month who asked the loved one to drive them to the hospital and had a cardiac arrest, and unfortunately was not resuscitated for over 10 minutes while that family member was driving. And so we're really, really important to utilize these services during that time. So you'll get to the hospital, you'll be seen by the emergency department. They will do EKGs on you within, ideally within 10 minutes to be able to localize and see if you're having a heart attack. And this is a really, really important step early on, because some of the most largest heart attacks, the heart attacks that have complete heart blockage, they're really rapidly picked up on an EKG, which is electrical signals that we're able to capture in the heart. If you are having such a heart attack, doctors like myself are get involved at this time. You would, be rushed to the cath lab. We are typically able to get a small needle into just the blood vessel of your wrist and bring small, tiny tubes or catheters into your heart and inject dye into the heart. We're able to localize the blockage and use wires, balloons, and small stents, sometimes even suction catheters to suck out clot, to balloon the clot to the side, and then to trap it behind a stent so that it restores blood flow to the heart. And ideally, we hope that patients get good outcomes and we're able to take really good care of them. Now, what I typically specialize in both clinically and with my research is really large heart attacks that have, unfortunately, a high mortality rate, where people who have such big heart attacks that they're not able to get blood flow to the brain, to the kidneys, to the liver, they usually only have about a 50% chance of making it out of the hospital. And so we really have tried to focus in on newer technologies and tools to be able to help those patients. And I think for patients and for clinicians, it's really important to know what the next frontier is in cardiology so we can try to help achieve that for our communities. And so I thought I'd share a little bit of that with you. Before I do that, I thought another important point is to really just emphasize how important it is to be able to get care quickly. So this was a recent research paper that we wrote looking at these largest heart attacks that I was talking to you about. But this is also the same case with smaller heart attacks as well. What you'll notice in the first column is mortality, the risk of passing away. So if you look at white males, they have a 33% risk of passing away when they come in with a heart attack that's, very large and causes weakness in their heart. And you can see that women all across the board, Caucasian, African American, Hispanic, and other minorities as well, they have a significantly higher risk of not making it through the hospitalization. And it's really, really important for our sisters and the women in our community to understand not to belittle the symptoms of a heart attack. It's really, really a critical nuance that we understand what these symptoms are and that we act upon them quickly. It's really, really important not to belittle these symptoms and to think of it as heartburn only, to think that it'll go away. Sometimes women can present without the classic chest pressure and pain and have more vague symptoms, but it's really important to, if there's a concern, to seek medical help as quickly as possible. So as I mentioned, most of the research that I do in the clinical work is associated with these fancy heart pumps that we can use to help patients, when they're really in catastrophic events. And I thought that I would share with you this a little bit because I think it's important to be able to know what's out there when you're looking to have your own family members treated, and so that you can push and advocate for yourself. Because one of the things that's really important is to understand what's available so that you and your loved ones can potentially get this, and for the clinicians within the group so that you understand what your patients have a potential of being treated with. So this was a 65-year-old woman. She had only a history of high blood pressure. She came into a hospital in the community and she had chest pain, and basically she had a large heart attack, and her heart function was really weak, and it caused fluid to build up within her lungs to the point that she needed to be put on a breathing tube. And the blood pressure was really low, and she was not getting enough blood to her brain, kidneys, and liver. And I think in most communities, a patient like this would unfortunately have a really bad outcome. And you can see this is a patient that I took care of. We brought this catheter that I told you about into the heart, and we looked at this heart blockage that was there, and we found all of this blockage, and we were able to actually stabilize the patient with these heart pumps that are able to, restore the normal perfusion. And then we were able to place balloons and stents in all of the patient's arteries that were blocked and basically restore normal blood flow. We kept the pumps in for a couple of days. And despite the patient having a really high risk of passing away, we were able to achieve a really good outcome for this patient. And so in America, if you have a heart attack, you typically have a less than 5% risk of passing away. And so we're getting really, really good nationally at being able to treat this. And so it's really, really important that we understand everything that's available. So to conclude my talk for today, I just wanted to remind us that heart attacks occur frequently. Black and brown persons are at higher risk of heart attacks and its complications. A healthy lifestyle, treating underlying illnesses can prevent a heart attack from occurring. If you or a loved one experiences a heart attack, you must seek medical care quickly because time is muscle. The longer that blockages occur there, the more the muscle is damaged and the harder it is to get a full recovery. We know that there are significant disparities in care, particularly within the Black and Muslim community, particularly within our sisters. It's really, really important to improve these outcomes and not to minimize symptoms. And I'm a huge advocate of the importance of seeking second opinions and having really good conversations with your healthcare team. Ultimately, you are the advocate for your patient, for your family member, and for yourself. So it's really important to try to seek out physicians who will care for you and who deal with the most complex problems that patients potentially see, because they're the ones who typically have the most expertise in being able to treat patients. And so if you're ever told that there was nothing that somebody can do for your heart blockage, or that the only option for your heart blockage was, a big surgery, and that stents weren't an option, or somebody who said, the other way around, that you could only get stents and surgery wasn't an option. It's really important to try to validate that with another opinion, and be comfortable with the doctors that are taking care of you and your family. So that's it from my side. I really want to thank everybody for attending. I did want to go to the next slide, which just has my email information on it. But oh, there we go.
Oh, there we
so
go.
That's my email and my Twitter. If I can ever help anybody, please let me know. I will stop sharing my screen, and maybe we can go to some question and answers.
Yes. We have some questions, and that was very, very good, mashallah. That was very informative. How long have you been practicing cardiologist for?
I've been here now for 8 years.
8 years? Oh, mashallah. Very nice, very nice. So what I have a couple questions. One of the questions was, what is the best way to prevent a heart attack?
Yeah, that's great. I think it goes back to what we were talking about earlier in the first few slides. It's really, really important. I think there are 7 principles, one that you can't control. So the one you can't control is your family history. The things that you can control are controlling your hypertension, your high blood pressure, your high cholesterol, and diabetes if you have those diseases. And then in terms of patients who don't have those diseases, or even those who do, not smoking, eating a healthy diet, and exercising regularly. It's really, it's almost cliche to say this. I mean, those are really basic things, but they really do the most amount of benefit. And so we should stick to that.
Inshallah. And the other question I have is, with the current COVID crisis, what should you do if you're having chest pain?
Yeah, it's a great question. We know from data from all across the country, particularly from Midwest centers, that in the current pandemic, that less people have come to the hospital with heart attack and stroke. And there's no reason that would actually, occur naturally. And what we presume is happening is actually that patients are scared to come because of the pandemic, and they're holding off on coming into the hospital, and so they're presenting much later. So we've seen, unfortunately, patients who come with bigger heart attacks, and unfortunately the muscle has caused holes in their heart, or they've passed away, and it's really, really unfortunate. So anybody who's having symptoms of a heart attack should really come into the hospital as quickly as possible.
Okay. And one more question, how do you decide on treating heart blockage with stents or surgery?
Really good question. I'm biased as I'm a stenting doctor. I'll tell you that, I feel like we can treat almost any kind of heart blockage with stents nowadays. I think surgery is really important for patients who have diabetes, because they tend to have really long heart blockage. Also, people who have really complex blockage at intersections of the heart where they're, when we stent, we would have to kind of do crisscrossing stents, things like that. Those are areas where surgery is sometimes better. But we're getting really, really good at balloons and stents as well. I think if you get an expert in that area, you can potentially get a really good outcome. But it's really up to the local team that's there. There's always a local expertise. And when you have multiple blockages and somebody recommends surgery, it should be really, really thought out of. As a community, I always feel that we're scared of big surgeries. And that's rightfully so. I think that, there's a lot of complications that can occur, but when you need it, you need it. And if you're young, it can give you a really long lasting and durable result as long as you're being treated by a good surgeon. So it's good, you have to have good communication and trust to be able to go down that road. But all options are available.
Okay. Yeah, it's really important. I had a question myself actually for the heart. What age do you recommend for an individual to go and get a full diagnosis of the heart, or like heart imaging to check whether or not if your heart is blocked?
Great question. I actually think so. It depends upon a patient's risks and their family history. But I would encourage, honestly, any adult over the age of 18 basically to get a cholesterol profile and to get an idea of what their cholesterol is, particularly for those of us who know we have a family history of heart blockage at a young age, or family members who have had heart attacks. I think it's really, really important after you get above the age of 40 to take a really close look. And there is a scan called a calcium score. It's a low radiation CAT scan, and it doesn't involve any dye or anything like that. It takes about 5 minutes to do it. You get run through a CAT scan, and we look for calcium deposits in the heart. And if we know that somebody has calcium deposits in the heart, then we know they have plaque in the heart. Now, that test doesn't let us know if they have a 90% blockage or a 10% blockage or 20% blockage, but knowing that you have the calcium in your heart lets you know that that process has started, and you may be more motivated to change your lifestyle, and potentially, based on a person's risk, you may be more motivated to take cholesterol lowering medication to help prevent heart attacks from occurring.
Wow. I didn't know about the calcium deposits. That's really interesting. MashaAllah. So, Jazakallah khair. We're really happy to have you today. I hope we have you in the future webinars for IMANA. And it was really informative and really helpful. And to all the viewers out there, thank you for watching. Please visit imana.org for more information. Also visit our Facebook page. It's Facebook.com/IMANA Cares. Inshallah, Dr. Basir, really nice having you. We'll see you again.
Thank you so much. Jazakallah.
Inshallah. Take care. Have a great day.
You too.
Assalamu alaikum.
Islam.